Dr. Blake Staker here with Westside-Medical. Today we're going to talk about how to treat chondromalacia patellae, or some patellofemoral pain syndrome. And it's honestly, it's tricky to treat, because what happens is that you can have like a knee injury, like a meniscus injury, or a sprain strain, or some kind of traumatic injury. What happens is like this middle quad here, the vastus medialis and vastus medialis obliquus, these muscles shut off, and then this vastus lateralis, these outside quad muscles, they actually overcompensate. So what happens is that these muscles get tight, this gets weak, and it pulls the patella over, and the tracking is thrown off, and that causes that wear and tear in the cartilage underneath the patella. You start developing that pain and that grinding. So the first step, we want to just work out these adhesions. We like to use this Voodoo floss that Dr. Kelly Stark came up with. So we're going to wrap the leg, probably about 50%, because you're going to, actually you can do 50 to 70%. 50% would be more for inflammation. 70-80%, like that tight wrap, will help to work out the adhesions. And when you do this, you want to wrap it, probably give yourself about an inch of overlap. You always wrap towards your heart to work out the inflammation. Like so. But when you do it, also listen to your body. Like if you get to a point where your body's just, you start to feel like that panic mode because it's so tight, that's a good indicator to take it off. But let's say you want it tight enough because it's going to contract, it's going to pull, rip apart all the adhesions through here. It's going to help that patella track properly. So once you get hooked up there, you can grab onto something like this, and you're just going to just squat down and put your knee to that range of motion. Just squat like that. Good, that's just going to help floss and pull apart those fascial adhesions that's causing some of the patella tracking issues. So maybe do about 10 of those and pull it off. Now the next step, you can get a foam roller, which they have at Westside Barbell or any other place. And you're going to foam roll this quad here. You do that to break up the adhesions and to kind of relax that tension, this fascia that's pulling the patella. So the proper way to foam roll your quad is you can kind of first do a couple passes to kind of loosen it up, and then you want to compress it and then pull those fascia through that range of motion. So you find the tender spot, compress, and you're going to pull, and that tension is going to pull apart the adhesions, just like that. If you can find a tender spot, you can roll back and forth on it to do some cross friction to break it apart. So now that you've released the adhesions through here and on the outside of the leg, now you want to strengthen the vastus medialis here. And that muscle is fired in like the terminal extension of the knee, the last 15 degrees. So you can take a therapy band like this, hook it on something, and we'll do what they call TKEs, or terminal knee extensions. This is just really good just to do anyways, just to warm up your knee. But you're going to step back at tension, you relax your knee, the band pulls it tight, and you just contract it just like this. You want to do high rep stuff just to stimulate hypertrophy in the muscle. So you can do about 30 of these in 2 to 3 steps, just really to fire the vastus medialis. So it's going to take, it takes time to fix the patellofemoral syndrome, because it took a long time for the biomechanics to be thrown off. So just stay at it and do this about twice a week. So that's working the vastus medialis. And one more exercise I like to do is take a Physio ball, and I'll demonstrate. Let's say we're working the right leg. Take a Physio ball, and you're going to lean into it, and that's going to keep the weight kind of balanced on this leg, like this. And you just kind of bend down like this and just go up like that. And it's different than just doing it with your straight body weight, because your weight's kind of thrown off because you're trying to stabilize, your body, versus when you have the ball here, you actually lean into it, and your leg can go through proper mechanics. Your knee can track over that joint where it needs to be, to work the vastus medialis. So hopefully that helped. visit us at westside-medical.com.